Hey, the time has come. Many students are asking me, Dr. Talari, when are you launching your group coaching program? And the time has come. You will hear about this next week, but over this week, I will do a couple of videos and explain, the course, the program, why it is important and how we are going to work together. This will be the last batch for this year because I want to work with a group of very little group of doctors where I want to help them get some success stories, get some testimonials, get this program better. And next year, once I have more testimonials, I want to launch it at a higher price. So if you want to get this course for the best price, this is the time. So 70 to 90% of doctors are failing the clinical exam. The reason is it's not the knowledge. If you passed your MCQ exam, that means you have the knowledge to practice as a doctor in Australia. So why are you failing? Why are you struggling? Doctors are struggling to get a date for the exam. People have messaged me saying, Dr. Talari, can you do a video on how to book the exam date? See, that is the demand that is there at the moment. So when you get a date, imagine if you go there and fail. That is the most dumbest thing you can do in your life, is when you get a date, you're not going there and passing the exam. So 70 to 90% of doctors are failing. And that's why there are no exam dates. And the reason is it's not the knowledge. It's the structured approach. It's the frameworks. It's the strategies. It's understanding the Australian healthcare system. It's not knowing what to do. It is not knowing when to refer the patient. It is not knowing what to do when a type of scenario is there. And it is so many things. It's not the knowledge. So it is the approach, it's the strategies, it's the frameworks. These are the key. Unfortunately, a lot of doctors who are actually teaching this clinical exam are not even working in the Australian healthcare system. It is sad to see that someone like you who is desperate to pass the exam is learning from all these people and failing the exam. And that's why 70 to 90% of people are failing. Currently, I'm working with a doctor who is actually working in the healthcare system, who worked in the emergency, who did his RMO years and working for a while, took the exam 6 times and he has failed. So it is not just knowing the system. It is not knowing the knowledge. There are a lot of things beyond that. It is the time management. It is the frameworks you need to use. It is not the Socrates network. Socrates is not going to help you. The mnemonic is not going to help you in any way. You should know how to implement the Socrates. You should know what to tell the patient when he says this. You should know what to tell the patient when this is what he is telling you. If you don't know that, you're going to waste your valuable time. And if you waste time, you will miss out on finishing the task. Because you're under pressure, you miss the crucial points or the key diagnosis, and the examiner will think you're not a safe doctor. So if you're preparing for pesky, AMC clinical or any clinical exam on planet Earth, trust me, this is the best program. There is no doubt this is the cheapest program, and I can tell you this will be the cheapest program in entire Australia. The reason I'm doing this is I want more testimonials, I want more case studies, I want to help as many doctors pass this clinical exam and be successful clinicians. So if you are keen to be successful in your clinical exam, make sure you reach out to me, because people who reach out to me, people who are in my group, will be getting the discount code, and the discount code will last on next Sunday is when I'm going to release the discount code. So make sure you get in touch, you message me, you ask me, tell your study partners. We will have this small group and we will work together and get all these strategies right. So this will be the best coaching program in Australia for 2025. That's my only goal. It's not making money from doctors who are desperate. This is me trying to help as many doctors as possible, because in the next 3 to 5 years, there are going to be so many nurse practitioners coming into the system, so many pharmacy practitioners coming into the system. So if you are not getting into the system soon, there is no point in getting into the system after 3 to 5 years. So this is the best time. Again, you might think I'm telling this to sell my course. Seriously, I work full time as a doctor. I'm a clinician. So I make money when I see patients, not when I take $100 from a doctor. So the reason I'm saying this is some of the doctors who might work in my clinic. That is my main goal, is I want you guys to work with me in my practice. If I know that this doctor is a super rocket-like doctor, I will recruit you, okay? And again, there's no guarantee that I will recruit everyone, so there are certain criteria you need to meet to be recruited. So my goal is teach as many doctors as possible, get the smartest doctors, work with me, and that's when I make money, not when I teach you a course for $100. But all I can see is lots of desperation, frustration, exploitation. People who are not qualified to teach you are actually teaching this clinical exam courses, and people who are like you, who are in desperation, are spending money, wasting your valuable time. You're not getting an exam date. You book the exam, go half prepared and fail. So if you want success, if you want that future goal of working in the Australian healthcare system, this I think is the first step. And again, this course, the group coaching program, is launching next Sunday, and I will only take certain number of people, and if you're lucky, you will be in that. All I need from you is a testimonial and feedback, because next year the same program will launch at a crazy high price, because I know that this is the best program in Australia. I don't teach things like Socrates, or I don't teach things that are in medical books. I teach concepts which I have created myself. So that is my intellectual property, and I can charge any amount for it, because it will change people's lives. It will make you a better clinician. It will help you pass more exams, your fellowship exam. AMC clinical is nothing. AMC clinical or any basic clinical exam is nothing. It's the initial stage in your journey. You have to pass your fellowship exams. You have to deal with Australian patients. So if you believe that Dr. Talari can help you, make sure you get into this program. Somehow you do this. Again, as I said, I'm only working with a small group of people, and I will select people. Not everyone will get a chance to get into this training program. You need to be motivated. You need to be doing assignments. You need to jump on calls where we do role plays. If you're not serious, don't even think about this. Okay, just leave the video now. This is not for, time wasting people who just want to take the exam for fun. This is for serious people who want to be good clinicians and be successful in the Australian healthcare system within the next 12 to 18 months. So if you're serious, type the word ready under this, and I will be in touch with you, and you will be the first person to get that code. The code will not be released now. It will be released 24 hours before the real launch goes, and you will save so much money, and you will have skills to be a good clinician in Australia and be a good doctor. I wish you all the best. I hope we join on this group program. I hope we work together in the future as great clinicians.